Hi everyone, myself Dr. Shilpa Ellur. I'm an obstetrician, gynecologist and fertility consultant at Milan Fertility, Whitefield branch, Bangalore. Today I'm going to speak about IUI. So what is IUI? Who requires IUI? What are the prerequisites for IUI? Whether it is a painful procedure, whether it is a daycare procedure, whether anesthesia is required, what are the steps for IUI and what is its success rate? So IUI is a very common procedure. It is done in an infertile couple. So what is IUI? IUI is intrauterine insemination. That is deposition of the sperms into the uterus above the internal os at the time of ovulation. Just before I start my topic, let me explain you about the female reproductive organ, which consists of a uterus, the ovaries and the fallopian tubes. So, in a woman who is having a normal cycle, that is 28 to 30 days of cycle, in her, she ovulates in the mid cycle, that is around 14 to 16 days. During ovulation, what happens? The egg in the ovary gets released into the fallopian tube. At the same time, if she has a relations, the sperm from the vagina gets swimmed up and come to the fallopian tube. And the actual fertilization happens in the fallopian tube, and this embryo comes back and attaches to the uterus. This is how the pregnancy happens. So, who all require IUI? So, any infertile couple, that is, a couple who has tried for pregnancy for 1 year without any protection and have not conceived, they are called as an infertile couple. In an infertile couple, in case of unexplained infertility, that is, her basic investigations in the female, that is, her uterus, ovary, and the fallopian tubes are normal, that is, fallopian tube is patent, and the husband's semen parameters are normal. In spite of this, they are not conceiving. Then we advise for IUI. And in case of mild male factor infertility, that is when the parameters, like when there is a mild sperm count is less, that is the normal sperm count is about 80 to 100 million, and according to WHO, minimum 15 million of sperms is required for the natural conception. If the sperm count is less than 15 million, but not too less, it's about 10 to 15 million, that time we advise for the IUI. And in case of the motility is mildly affected, then we advise for IUI. In case of the morphology of the sperm should be normal, then we advise for the IUI. The next conditions where we advise IUI are the ejaculatory dysfunction. If the husband is having diabetes or retrograde ejaculation, or if the couple is if the male partner is having the erectile dysfunctions, and all these conditions we advise for the IUI. And in the female conditions like endometriosis, if the endometriosis is of mild to moderate variety and they are just married for 1 to 2 years, we advise for IUI. So, what are the prerequisites for IUI? The woman should be less than 35 years, and up to 40 years we do IUI, and she should be having a normal uterus. The fallopian tube should be patent, either at least tube should be patent, and she should be ovulating regularly, either spontaneously or induced ovulation. In those women, we can do IUI. Is IUI a painful procedure? No, IUI is not a painful procedure. And do IUI procedure requires hospitalization? No, it's a daycare procedure. You have to visit as a OPD procedure, and after the procedure is done, she has to take rest for 15 to 20 minutes and she can leave the hospital. So what are the steps for IUI? So initially, the couple have to visit the doctors on the second day of the periods. The basic blood test and scan will be done, and certain medication will be given as a ovulation induction for the follicular growth. And she will be called on 8th or 9th day of her cycle to monitor the follicle. And when the follicle is 18 to 20 in size, they give a trigger, that is HCG injections, following which 36 hours IUI will be done. So after that, hospitalization is required or rest is required? No. She has to lie down after the procedures for 15 to 20 minutes and she can leave the hospital. So what happens on the day of IUI? The husband has to give the semen sample. The semen will be processed. That is, it will be liquefied for 15 to 20 minutes, and following that, it will be processed. Processing means what? We separate the dead, non-motile and debris from the semen, and the good motile sperms, what we get, is installed into the uterus from the small catheter into the uterus. So deposition of the semen, processed semen into the uterus is called as intrauterine insemination. And what is your success rate? The success rate about any IUI procedure is about 15 to 20%. So, for any given couples, at least 3 to 4 cycles of IUI is attempted before they go